Good evening. My name is Dr. Light. I'll be conducting some checks for you this evening. I'll be making some notes as we go through with each assessment. Is that okay? Okay. So, if you'd like to just keep your eyes looking straight ahead for me, I'm just going to do a quick pupil check to begin with. So just look straight ahead. Okay. Do you have any sensitivity to light? Bright lights? Is the light in the room okay for you? You just let me know, okay, if it gets too much and I can dim the lights. Okay. So, do you mind if I ask you some silly questions? Okay. Do you know how old you are? Okay. And when were you born? Do you know your birth date? April? Okay. Do you know where we are? And what year is it right now? I had to think about that one for a second. Okay. And can you tell me what 3 plus 5 is? Okay. Good. Okay, excellent. So, if you'd like to say ah for me, it's going to have a look at the back of the throat. Say ah, that's it. And looking at the health of the teeth as well. So you've still got your tonsils. Did you suffer with a lot of tonsillitis when you were a child? Some scarring on the tonsils still. So I decided to keep the tonsils, yeah. Okay, and do you find that you get a lot of seasonal colds, seasonal allergies? Just having a look at the teeth as well. No issues there. You had any dental surgery, any dental work recently? Any crowns, any root canals, anything like that? Okay, lift up your tongue for me. Okay, you can relax your tongue and you can relax your mouth. Okay. So we're making a little note here. The tonsils still present. Okay. So once I've done these preliminary checks, I will do a full physical exam as well. Okay, put my gloves on and do some palpating for any lumps and bumps, any obvious signs of swelling or any tenderness, that sort of thing. But for this moment, you say that you don't have any obvious pain or discomfort, no throat pain. Okay, how about when eating and drinking? Any discomfort there, any difficulty? Okay. And how much water on average do you drink every day? It's not a test, don't worry. Okay, so we'll check hydration levels. Just having a look at the colour of the whites of your eyes. Okay. Just look up for me. Okay, keep looking up. Okay, look over here. Look over here. Okay. So no obvious signs of any sort of liver function issues. Have you ever had your liver enzymes checked? A blood test? No? Okay, I'll put in a form for you to get that checked. So that's just a precautionary check. There is no obvious signs of any elevation, okay? In fact, on physical examination, you appear to be in good health in terms of liver function, and this is just a precaution that we would do as part of the follow-up, okay? Alright, so I'll put in a form for that. That's form 185B. Okay. Okay. Any trouble with the ears? Any trouble with your hearing? Okay. Any sensation of fullness in the ears? Any problems with your balance? Do you ever get a sense of vertigo? Feeling uneasy or off balance on your feet? Okay. So I'm going to have a look in your ears with my otoscope here. Okay. I'm going to be quite thorough, so I will take a little bit of time. So I'm going to come a little closer if that's okay and just have a look inside the ear. Okay, just have a look here. I'm just going to move your hair out of the way if it's okay. Alright, so let's have a look and see. So just checking in there. Okay, so I'm looking here at the health of the eardrum. I'm also having a look to see if there's any obvious signs of polyps in the ear. Anything untoward, anything unusual, okay. No signs of infection or anything like that to be concerned about. do that. Tap, 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 tap. Nothing. Okay, no discomfort, no pain. Any distortion to the sound. Okay. Just gonna move a little bit closer and have a look. Let's see. Okay, good. Okay, so that all looks pretty good. Okay, I'm going to check the other ear. Just come a little closer if that's okay. There we go. So just going to move your hair out the way as I did on the other side. There we go. Okay, so let's see. Just taking a little look into the ear canal, just seeing here. Okay. So no obvious signs of infection, no signs of polyps. Eardrum's looking really good. Okay, and then as I did before, if I tap here. Do a little tap, 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 tap. Do you notice any discomfort or pain? Any issues with the sound? Okay. So let's see. Closer look at it. Okay. See here. Alright, that looks good. Okay. That looks pretty good. So no obvious signs of any ear infections and no unusual growths, no signs of any polyps in the ear. In terms of earwax build up, I didn't see any obvious signs of impaction. Okay. How often do you have your ears cleaned? Have you ever had them done by an audiologist? Mm-hmm. Okay. Yeah, all right. Okay, so ears. I also did the palpate test. Okay. So now you notice there was some distortion. Okay. On both sides or just on the one? Both sides. Okay, and would you say that one side was worse than the other, or were they about the same in terms of the audio distortion that you could hear? Mm-hmm. Okay, and what kind of distortion was it? Was it an echo? Was it a high-pitched sound, almost like an electrical interference? More of an echo. Okay, good. And do you notice that effect come up normally, like now when I'm talking to you, or did it just happen in the moment? Have you noticed before? Okay. 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 Good. So I'm going to do a hearing check with you. Okay. This is just precautionary based on the findings from the otoscope exam. Okay. So I have here a lovely comfortable pair of noise cancelling headphones. I'm going to place them over your ears for you, and you may notice that the sound ends up being a little bit muffled. Okay, so are you happy for me to place them on for you? Okay, so just carefully, there we go. There we are. Okay, just carefully place them there. Okay, so can you still hear me okay? You can? Excellent. Okay, the sound may be a little bit muffled as I said before, but as long as you can still hear me. Okay, good. So I'm going to run some tests for you. Okay, I'm going to play you some sounds in each ear one at a time, and I want you to tell me if you can hear the sounds clearly or if there are any distortions. Okay? Okay. So I'm just going to get my notebook. Okay. So the first sound.
The high in central London, 12. That's 55 Fahrenheit.
Okay, can you hear it okay? Yeah? Good. Any distortions? Any echo?
If you're coming into London from the south, avoid Tower Bridge this morning. There's a half-mile tailback.
Good. Now, the second sound. You can hear it okay? Do you notice any changes to the sound? Any distortion? Okay. Any effect in pitch or tone? Mm. Okay. 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 So I'm going to play the next sound for you. How was that? Any problems hearing that? Did you hear it okay? Okay. Good. Okay. And the next sound. Any problems with that one? Okay. Okay. Good. Okay, so whilst you have the headphones on, I'm going to say a few words, okay? And I want you to listen and I want you to repeat them back to me. Okay? Snow White and the Seven Dwarfs. Little Red Riding Hood. Cinderella. Pink Peppa Pig. Rainy Days and Sundays. Okay, good. Alright, so you did that very, very well. I'm going to remove the headphones for you now, okay? Just come around here, just gently. Okay, so I'm going to remove them now. There we go. Okay, you can hear me okay? Good. Alright, so based on those results, I am going to refer you to our audio specialist, audiologist, for further assessment, okay? Again, that's just a precaution based on the previous results. Okay, we just want to make sure that everything is working fine. Okay, but in terms of cognitive function and actually your brain making sense of sound, I don't have any queries, I don't have any concerns. So I'll just put through another form for you. That's form 22B. Okay, so I'll just get that signed for you and sent off. Okay, right, I'm going to turn over to a fresh page. Okay, so we're going to take a listen to your heart and your lungs and your pulse. Make sure it's not too cold. Okay, good. So I'm going to just place it here and ask you to take a nice deep breath for me. Okay. Have a listen here. Okay. Okay. So that sounds fine. I'm just going to take a listen here and just glance up at the clock behind you. Okay. Just pulse. Okay, good. So there doesn't appear to be anything of concern with the heart rate or the pulse, okay, and the lungs sound nice and clear. I am going to check your blood pressure. When was the last time you had your blood pressure checked? And were there any problems? Okay, have your left arm. I can touch a cuff with you. Just going to touch this around here. Okay. So we have quite a nice sophisticated machine. Just make sure that it's not too tight. It is going to tighten just slightly on your arm as the machine works, but it won't make any annoying beeping sounds, okay? And I'm just going to have a little listen whilst we're checking blood pressure, okay? So, deep breaths, that's it. Okay. Okay. Good. All right. That's fine. That's fine. That looks good. I'm happy with that. That's quite normal. Okay, so let me take the cuff off for you. And just take it off your sleeve here. Okay, good. Right. So let's just make a little note BP. Okay, heart rate, pulse. Okay, and then no signs of any lungs. Okay, so pulmonary health looking good. Okay. All right. Okay, so I'm going to put some gloves on. So that I can do a physical check. So I'm going to come a little closer and do a scalp exam, and then I'll work my way down to check around the face. Okay, so I'll do a gentle palpation on your cheeks, checking your sinuses. I'll also be checking the back of the neck into the shoulder area. Okay, I'll do a check down your arms for any lumps and bumps, any swellings, anything like that. Okay, and then I'll work my way down to the sternum area. Okay, and then I'll check the abdomen to make sure that everything is as it should be. Okay. Now, if at any point you have any questions or you feel uncomfortable or a sense of tenderness or discomfort, do let me know. Okay. Okay, so I'll just come a little bit closer. Just have a look at the scalp here. So just start by taking a little look at the scalp. So here I'm looking for any indentations in the scalp. I'm also taking a note of the condition of the skin, looking for any signs of sun damage at all, any moles, any freckles that look unusual. Also just having a look to see if the scalp is healthy or if there is anything that is presenting as abnormal in any way. Okay, so just have a look here on this side. Okay, just checking a little look here, just carefully. Seeing if there's anything untoward, anything unusual in any way. It all looks quite good actually. All looks very healthy. Okay, so just checking here. Okay, I'm just going to come a little closer to the top of the head. Just have a look carefully for anything that might be needing a little bit of TLC. Just carefully to have a look along the hairline. Just take a look here with it. Okay. So just gently combing through each inch of the hairline on the face. Okay. Just making sure that there are no obvious signs of skin damage. You've got to be very, very thorough in these areas that are often hidden from view, just to make sure there's nothing there that would need to be seen to. Okay. Look at this. I'm going through, are you noticing any sense of discomfort, any tenderness at all? No pain or discomfort, that's good. Okay, I'm going to reach around you. Okay, so that I can have a look and just have a little palpate around the back. Any pain here, any discomfort around the back of the neck? Okay, just feels quite nice. Okay, that's quite normal. Okay, but no pain, yeah, no discomfort. Okay, that's good. Just come over here. Okay. Okay. Good. So I'm going to gently touch your face, okay? Just going to gently press here. Press. Now, I'm just lightly applying pressure to your sinus area. Do you feel any pain? Okay. Okay. Good. And what about now when I press here around the jaw area? Press here. Mm. Okay. Good. So let's have a look at the shoulders. I'd like you to sit up nice and straight for me. That's it. Good. I'm going to just press on your shoulders. Do you notice any pain or discomfort? A little bit of tenderness. Okay, so that's a bit of tension, I would say. Okay, so relax your shoulders for me. Okay, and I'm going to ask you to lift your left arm, please. Okay, good, just the left arm. And I'm just going to palpate down the arm. Just checking for any tension, any lumps or bumps that feel unusual, any swellings. Okay, is that so? Just a bit of tension. Okay, good. Keep your arm out for me. I'll hold it. So if you keep your arm relaxed so that I hold the weight of your arm. There we go. Good. Okay, and just relax your hand for me. So just check your fingers. Okay, so blood circulation is good in all the fingernails. Good. You can relax that arm. Okay, excellent. So now let's do the same on this side. Lift your arm for me. That's it. Good. So I'm also going to just do a palpate of the arm. Okay, just checking for any pain, any tenderness. Any lumps and bumps, nothing under the underarms, that's all fine. No gland swelling. Okay. Good, and if you just relax the arm, good, let me take the weight. Good, okay. I'm going to just check your fingers. Excellent. Okay, good. You can relax now. You can relax the arm. Okay, good. All right. So quite a bit of residual tension in the neck and the shoulder area. Okay, which has been radiating down into the arms. I would imagine that that's from posture. Okay, do you spend a lot of time at a desk or hunched over? Commuting, that sort of thing. Okay. Have you been seen by a physiotherapist before? You had a physio assessment? Okay. So what I'll do is I'll put in another form for you to be assessed for occupational therapy and for the physiotherapist, just to make sure that that tension doesn't progress any further. Okay, so we don't want it to progress to a repetitive strain injury. We want to address it in the here and now. Okay, good. So I'll continue with my assessment before I make my notes. I'm going to do a quick palpate of the clavicles, so around the collarbone area. Okay. Any pain here or discomfort? Okay. You're doing really, really well. Okay, on this side, any discomfort? No signs of any swellings or any lumps and bumps. So that's nice and clear. Okay, good. So now I'm going to have a palpate around the sternum area. Okay. Do you notice any tension there? Any feeling of fullness? Okay. Do you ever experience indigestion? Mm-hmm. Okay. Okay. So I'm going to have a assessment or do an assessment around the abdominal area. Okay, so I'm just going to do a little palpate around the ribs on this side first. And you tell me if there's any pain here or discomfort. Okay, so just around the back. See. Okay. Any tenderness here? Okay. A little bit ticklish. Okay. That's quite normal. Okay, so let me have a look. Just see around this side as well, around the ribs. So just checking the kidneys. going to just gently palpate around your tummy. Okay. So if I come a little closer and just lift up a little bit here, if that's all right with you. Is that okay? Okay. All right. So I'm just going to lift up here, just gently. Okay. I'm going to press a little bit here, just check. That's okay, not painful. Good. All right, good. Excellent. Okay, so put your top down there for you. Okay, I'm going to have a look on the other side as well. Just lift up a little bit for me. That's it. And I'm just going to press a little bit harder here. Is that okay? Okay. Good. All right. Good. 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 There's no problems there. All right. Excellent. Okay. Perfect. Good. You can relax. Okay. So I'm going to make some notes. So we said we would order for the physiotherapist and for the occupational therapist. Okay. So I just put that order in as well. Okay, so we're just going to make some notes about the tension shoulders. Okay, and then spleens, absolutely fine, no signs of any swelling or inflammation there. Okay, kidneys, no problems. Good, no obvious signs of any pain or discomfort. Okay, and then stomach, liver presenting, no obvious signs of pain. Okay, so I wanted to ask you about the scalp health. Now, when was the last time you visited a dermatologist? Have you been before? You haven't? Okay. Alright. So you haven't done any mole mapping before? Where they take a photograph of your different moles, different lesions on the skin, freckles, in order to notice any changes over time. Okay, alright. So I will recommend that you visit our lovely dermatologist. She's really nice and she's so knowledgeable. So I recommend that you go to see her. Again, just as a follow-up precaution, okay? So, this is a very thorough, detailed, full body examination. And as far as I can tell from my investigations and my observations, you are in good health. So these recommendations are really just to continue with your care, to continue with your well-being, okay? So there's nothing to worry about, but I really would recommend to follow up with her, and she can do a more detailed examination of your skin, your scalp, your hair as well, okay? Okay. All right. Okay. Good. Okay, so I'm going to remove my gloves. Okay. concludes your full body exam this evening. I trust that you found this appointment useful. Okay, if you have any questions at all, of course, don't hesitate to ask. And if you think of any questions in the following days, then feel free to reach out and to ask. Okay, I'm happy to answer any of your queries. And obviously, if anything changes, do come back and we can further assess for you. Okay, so you've got a couple of forms that are going to be sent off for a few follow-up checkups. Okay, so you'll be hearing from the office as and when those appointments have been scheduled in for you. Do let us know if you have any holidays booked in the next 3 months or so. Okay, so that we can get you scheduled in with everyone. Good. So, thank you so much for coming to see me. It's always a pleasure. Do take care of yourself now.